Hello, this is Priyanka Patil, working as an assistant professor, Srivile Parle Kilwani Mandal, Institute of Pharmacy, Dhude. Today, I am going to deliver a lecture on a topic, Posology. In Posology, we discuss about the definitions, factor affecting on dose, and the dose calculation. Let us start. These are the learning outcomes. At the end of this session, students are aware of posology and the dose or amount needed to produce a desired pharmacological effect. The second learning outcomes, students should be able to determine the minimum as well as maximum dose required for each and every category, especially for pediatric dosing. The third learning outcome, they must be aware of pediatric dose calculation. It means that they are able to calculate the pediatric dose as well as the several variables affecting on the dose calculation. These are the learning outcomes. Before moving forward, we should know the definitions of posology. The posology it derived from a Greek word. Generally, it is two Greek words. One is phosos, second is logos. The phoso means how much and the logos means science. We can say that it is the branch of medicine or pharmacy dealing with the doses. Together, it is called a science of calculation of doses. So before we discuss about the posology, we should know what does mean by dose. We can say that a dose is nothing but it is a quantitative amount that we are going to administer or taken by the patient for intended medicinal effect. If we want an intended medicinal effect, for that purpose we need to take some amount of substance or drug or medicament that going to show the action. That amount is nothing but dose. But if we talk about the posology, it is nothing but the medicinal branch of medicinal science which deals with the dose quantity of drug which can be administered to a patient to get a desirable pharmacological action. It means that basically what we do in posology, we calculate the dose of drug to administer to get a desired effect. So that is nothing but posology. In posology, there are two terms are involved. One is maximum dose and second is minimum dose. The first is minimum dose. If we talk about the minimum dose, it is nothing but a lowest amount of dose that going to require to produce a intended pharmacological action. And the maximum doses, it is a maximum higher amount that is a dose required in higher amount which will be produce a desired effect, and it is generally tolerated by the average individual. It means that for let us say example 10 milligram is a minimum dose and 100 milligram is the maximum dose. It means that if you administered a dose that is 9 mg, it does not produce a intended medicinal effect as you desired. And if you taken 110 mg of dose, also causes some desired unwanted side effects. It means it produces the desired effect, but along with that it will show some adverse effect. It means that you need to take a dose or you need to calculate a dose in that therapeutic window, minimum to maximum. Generally, as we know, on administration of drug, a predicted response is obtained. But sometimes what happens, the individual may vary considerably in their responsiveness. Although they are administered same dose, some would show less than the usual response and some may show more than the usual response. They respond differently to that drug molecule both from time to time and from other individuals. Occasionally, individuals exhibit an unusual response that we can call as idiosyncrasy. Now the next is factor affecting on drug or dosage or dose. So now first is age, sex, body weight, body surface area, dosage form, frequency of administration, physiological conditions, synergism and antagonism, environmental factor, tachyphylaxis, metabolic disturbances, idiosyncrasy, tolerance and disease condition. These are the factors that going to affect on the dose calculation. The first factor is age. As we know, the age is the most common factor that influences the amount of drug to be given. The infant should require much less dose than the adult, while in elderly patient they may require a more or less than the average dose, and that will be depend upon the action of drug and the condition of the patient. As we know, in newborn infants, due to the high total body waters, low fat content, immature renal and hepatic functions, and different protein binding, they required a less dose, because as we know, due to the immature renal and hepatic function, the drug is not metabolized easily, and they have a different protein binding. So that's why at low dose they show the desired or required intended medicinal effect. In elderly patient, they mostly suffer from the renal and hepatic dysfunction, which decreases the elimination of drug from the body, and due to that the drug will stay in the body for a longer period of time, and it ultimately the half-life of the drug is increases. And as we know, the drug elimination is less efficient in newborn babies and old people, so that the drug produces greater and more prolonged effect at less drug concentration. It means that at low dose concentration, your elderly patient and newborn baby show the desired pharmacological action. Hence, we can say that a less dose is required in elderly as well as infants or newborn babies. Now, when you administer a dose in a children is showing the different response than the adult. For example, a tetracycline shows the teeth staining in children, while sulfonamide causing the bilirubins move from bloodstream into the brain tissue, and it may lead to the kernicterus. While some corticosteroid, when you administer in children, it may show the growth and development retardation. And certain drugs may lead to serious consequences. For example, chloramphenicol causing the grey baby syndromes. It means that these are all the different responses than the adults. The next is how to calculate the pediatric dose based on the age. Here we are going to see a different formulae. By means of that formula, we can calculate the pediatric dose based on the age. Now let us see. First is Dilling's formula. The Dilling's formula is the child dose is equal to adult dose multiplied by age in a years divided by 20. And this formula is most useful for the calculating the dose for a children in between 4 to 20 years of age. Next is Young's formula. The Young's formula is child dose is equal to adult dose multiplied by age in a years divided by age in year plus 12. And this formula is used for the calculating the doses for children of 12 years of age. It means that 12 years of age, if you want to calculate the dose for 12 years of age children, you can use the Young's formula. Third is Freud's formula. The Freud formula is child dose is equal to adult dose multiplied by age in a month divided by 150. Here age is given in a month, right? So this formula is used for the calculating the doses for infants under 24 month. It means that you can calculate the dose from 1 month child to up to 24 month age of the child. So this formula is basically used for the calculation of dose of infants or newborn babies. Now the next is Cowling's formula and Bastard's formula. The Cowling's formula says that the child dose is equal to adult dose multiplied by age at the next birthday in years divided by age plus 12. And this formula is used for the calculating doses for children 2 years of age or older. And best dose formula is equal to child dose is equal to adult dose multiplied by age in years plus 3 divided by 30. So these are for estimation of pediatric dose or calculation of pediatric dose. So based on this formula, we can calculate the previous formula, we can calculate some numericals for better understanding. The first numerical is in front of you. Here we are going to calculate the adult pediatric dose. That is, the sum is the adult dose of a drug is 325 milligram. What is the dose for a 3 years old child? By using Young rules, we can calculate the dose for the 3 years old child. The solution is given here. As we know, the Young's rule is child dose is equal to adult dose multiplied by age in years divided by age in year plus 12. When you put all this value, here a drug dose of adult dose is given and age of children is given. So 325 multiplied by 3 divided by 3 plus 12. When you calculate that value, you will get the child dose, which is 65 mg. And the next sum is for assignment, and you have to solve it and put answer in comment box. The next important factor is sex. We know that women are more susceptible to the effect of certain drugs than are males, and it happens because of person adipose tissue is greater in adult female as well as person water is lower in adult female as compared to adult male. And just because of that, on the basis of body weight, female adults generally requires smaller dose than the males. So these are the sex related factor. And we know that generally in pregnant women and nourishing mothers, they should use medication only with the advice and under the guidance of their physician. Why it is happens? Because as we know, some drugs like alcohol, anesthetic gases, barbiturates, anticoagulants, these are the few examples. When you administer these drug on pregnant women or lactating mother or nourishing mothers, that time the drugs are transported from maternal to the fetal circulation, and it might be causes some adverse effect on fetal growth as well as growth and development retardation in newborn babies and fetal. So that's why it generally prevented in pregnant women and nourishing mothers. See, already we discussed about that females generally because of less body weight, person adipose tissue is greater and person water is lower, it required less dose as compared to adult male. The third important factor is body weight. As we know, when we calculate any dosage form along with the age, the most important factor is body weight, and especially in pediatric dose calculation, body weight are more influencing than the other. So in the calculation of dosage, weight has a more direct bearing effect on the doses than any other factor, especially in the calculation of pediatric doses. Earlier we see that the age is one of the important factor that affect on the dose calculation, especially pediatric dose calculation. There we are going to use a number of formulae like Young's, Dilling's, Bastidose. So these are the formula used for the calculation of pediatric dose based on the age. Now here where the rules governing the calculation of pediatric doses based on the weight is Clark's rule, which is shown below. Here child dose is equal to weight in pounds divided by 150, that is average weight of adults in lb, multiply by adult dose. The official usable doses for drugs are considered suitable for 17 kgs individual. When you convert that 17 kg in pounds, you will get the 150, and that's why this 150 is put in this earlier formula. The ratio between the amount of drug administered and the size of body influences the drug concentration at the site of action. So therefore, the drug doses may require adjustment from the usual adult dose for in abnormally lean or abused patients. So here numerical is given. We can solve this numerical so that we can get an idea about the how to calculate the pediatric dose based on the body weight. The numerical is, what is the dose for a 14 lb child, that is weight of child in pounds is given here, if the average adult dose of medicament is 100 mg. So the given is what? Adult dose is given, that is 100 mg, and weight in pounds of that child is 14 lb, right? When you put that all the value in that earlier, that Clark's rule, the Clark's rule is what? Child dose is equal to weight in pounds divided by 150 multiplied by adult dose. So when you put all the value, 14 divided by 150 multiplied by 100, you will get the child dose in mg. That is we can say that we can calculate the pediatric dose based on the body weight. The fourth factor is body surface area. Generally, some drugs are there, they required to decide the dose of that drug based on the body surface area. For example, anti-cancer drugs, that is methotrexate, is administered on mg per square mm of the body surface. It means a close relationship exists between a larger number of physiological processes and body surface area. Many physiological factors such as plasma volume, oxygen consumptions, body electrolytes are proportional to the surface area, and that's why the surface area are used to calculate the dose. So average body surface area of 17 kg adult is 1.7 to 1.8 square meters. To calculate the dose of drug for children based on the body surface area is generally related to the weight. So many physicians, it believes that doses for children should be based on the body surface area, and since the correct dosage of drug seems more proportional to the surface area. So when we calculate the pediatric dose based on the body surface area, the formula is child dose is equal to adult dose multiplied by body surface area of child in meter square divided by 1.73 meter square. That 1.73 meter square means what? It is an average adult body surface area. Now let us solve one numerical for calculation of pediatric dose based on the body surface area, so that we get an idea about how to calculate the pediatric dose based on the body surface area. The numerical is given, that is if the average adult dose of drug is 50 mg, and what is the dose for a child who has a body surface area which is equal to 0.57 meter square. Here what are the givens? First is adult dose of that drug is 50 mg is given, and next is what? Body surface area of that child is 0.57 meter square is given. And as we know the formula, that is child dose is equal to adult dose multiplied by body surface area of that child in meter square divided by 1.73 meter square. And that 1.73 meter square means what? Adult average body surface area. When you put that all the givens, that is adult dose here 50 and body surface area of that child is 0.57 meter square, here you will get this type of equation, right? When you solve it, you will get the pediatric dose based on the body surface area, right? Now we summarize all the formulas for calculation of pediatric dose here. So already we discussed about that. We can calculate the pediatric dose based on the age, body weight and body surface area. So when we calculate the dose based on the age, the dose is proportionate to age. There are number of formula, that is Dilling's formula, Young's, Fried's, Cowling's and Bastard's formula are used for the calculation of pediatric dose based on the age. The next factor, the dose calculation, that is dose proportionate to body weight. Here one formula is given, that is Clark's formula, and that based on that formula we can calculate the dose, that is pediatric dose based on the body weight. The next is dose proportionate to body surface area. Already we discussed that formula, that is child dose is equal to adult dose multiplied by body surface area of that child in meter square divided by 1.73 meter square. So that is the methods of calculation of pediatric dose. Fifth factor is route of administration. So there are number of routes by means of that you can administer your drug and it will goes into the systemic circulation. So basically here two routes of administration we are going to discuss. One is intravenous route of administration and second is extravascular route of administration. So basically when you administer a drug via intravenous route, it will enters into the bloodstream directly, and thus the full amount of administered drug, whatever the drug you have administered, is fully present in the bloodstream. So it required less dose as compared to the other route of administration. Now in contrast to IV route, when you administered a drug via oral route or extravascular dose, so that time what happened? It is not fully absorbed via oral route. It almost 50% drug is metabolite and only near about 50% drug is available in bloodstream. So why it is happened? Because of various physical, chemical and biological barrier to their absorption. That includes interaction between your gastric and intestinal contents, and ultimately it requires higher dose to achieve the same blood level of the drug as compared to intravenous route. For example, a triflupromazine HCl, that is a drug, when you administer via oral dose and IV dose, the dose concentration is different. Here via oral route we require 30 to 150 mg per day. On the same the same drug, when you administer via IV route, it requires only 1 to 3 mg per day. It means that if you want to achieve the same blood level of drug, we require a oral dose is higher than the IV route. Why it is happen? Because your oral dose almost 50% drug is getting metabolized before it enter into the systemic circulation, and that's why it required higher dose than the IV route. So thus the route of administration is selected based on the severity of the disease. Now the remaining factor that affect on the dose calculation we will be discussed in next session. Thank you.